Hello, my name is Sami Gürbüz. I work as an obstetrician at NOVAFERTİL Fertility Center. I was born in Konya in 1973. I started my career as a health officer in 1991. And after 7 years of studying in the medical faculty and working as a health officer, I started my life as doctor in 1998. I completed specialization in Ankara back in 2003. I started working at gynecologist Women's Health and Diseases Hospital and then at the maternity hospital in Konya. As an obstetrician at NOVAFERTİL Center for the last 10 years, I've had the chance to help thousands of couples have children. Like any other obstetrician, I can perform procedures such as birth, cesarean section, pregnancy follow-ups, and operations. But I am specially conducting operations such as reproductive endocrinology, aided reproductive technology, IVF, and microinjection. One of my special interests is in hysteroscopy treatments. A large number of patients come to us every day. However, if noted annually, just in terms of IVF treatment, I perform IVF on around 1,000 patients. Since Konya is in the center of Turkey, we get many patients from close cities, but also ones from areas farther away, such as Ankara, Izmir, and Istanbul. In vitro fertilization is a very special treatment. Nowadays, it is important for the patients to be able to reach their physicians, and when patients come for a visit, the physician needs to spare time and discuss the treatments with them. Such an environment should be provided. An in vitro fertilization center should be a warm environment for the patient. Patients should feel comfortable there. Again, the patients must feel very comfortable with their doctor. They must trust their doctor and work with the person they have confidence in. At the same time, all of this must be done with team effort. In other words, it is much more effective to perform IVF treatment with a crowded team than to treat IVF with only one person in the laboratory. As a physician, instead of conducting this work with only one person, I prefer to work with a team of physicians as well. At the same time, scientific knowledge of the physician should also be considered. A patient should also examine how well his or her doctor is keeping up with developments in IVF treatment. We have guest houses for patients coming from outside the city or from abroad. They can stay here. We do not request any extra fees for this during their treatment. Again, there are 3 obstetricians and a urologist at our center, which means that treatment continues uninterruptedly when the patient arrives. Our center is equipped with advanced technological apparatuses and we carry out this work with very experienced embryologists. Our most experienced embryologist has about 20-25 years of experience. Our embryologist with the least experience still has 9 years of experience. If you look at it this way, I guess we can say that we are also very experienced in these fields. In our center, we keep track of the latest technological and procedural developments very well. In terms of transportation, we are in an amazingly easy location to reach. For patients coming from other cities or overseas, we usually start the treatment on the 2nd or 3rd day of the woman's menstrual cycle. Therefore, coming to us on any other day will not have any benefit to anyone. My suggestion is that the patient should contact us. Before they come, they should send us any medical reports they have. They can do this through email or WhatsApp. In this way, we can look over and evaluate the documents. Before the patient comes, we will let her know if there are any medicines she needs to use beforehand. Then, when she comes to us during the menstrual period, we'll start the treatment after an initial examination. We finish the treatment in about 15 days. After allowing our patients 3-4 days of rest, we discharge our patients. But we do ask for them to stay around Konya for roughly another 20 days.